The nearest cardiac center is 94 miles east, Banner University in Tucson. If I had a STEMI right now, a real widowmaker, LAD occlusion, the full presentation, I'd be dead before the ambulance cleared the county line. I've thought about this more than a doctor probably should, and I've decided I'm fine with it. It's 4:45 in the morning. It's always 4:45. 38 years of 4:45, and now it's just a body thing. The alarm doesn't exist anymore, hasn't for months, but the body performs the sequence anyway. It opens the eyes, it swings the legs, it goes. Out here, that means the step of the trailer, the first breath of desert that hits before the door is even fully open, which in June is already warm. Not the Phoenix kind of warm that tourists complain about. The Aho kind, drier, a mineral warmth like air coming off hot stone. The saguaros visible in the pre-dawn, shapes more than objects, 8-meter silhouettes that have been growing since before anyone alive was born. Some of them 200 years old, standing there in the dark. The Palo Verdes, the Ocotillo. I have a stainless steel mug. Cleveland Clinic, 1989, fellowship year. Someone handed it to me at some orientation event, the kind of event where you're 27 and you don't sleep, and the institution gives you objects with logos on them to reinforce that you belong to something important. I don't have much from that period. I have this mug. I use it every morning. It holds exactly the right amount of coffee from the butane burner. The handle is slightly bent from some impact I don't remember. It's the only object in this trailer I don't think about when I hold it. Everything else I've had to acquire out here has a kind of awareness attached to it. The folding chair, the paperbacks from the garage sale in Aho, the second water jug. This mug just exists. It was already broken in 40 years ago. It doesn't need anything from me. That's not why I left. I mean, the hours, the politics, the industry. People ask eventually, even out here. The Pemex truck driver who fills my cisterna every 3 weeks. He's spoken enough English that we've had whole conversations. He asked once what I did before. Cardiologo, I said. He looked at the trailer, looked at me, and did the math without saying anything. Eventually he asked, "Why leave?" "Too much stress," I said. And that's not a lie exactly. It's just not the reason. I need to explain what stenosis is, because it matters for what I'm going to tell you. Stenosis is gradual. The artery doesn't close overnight. Plaque builds up year by year. Lipid deposits, calcium, inflammatory cells adhering to the endothelial wall, and the lumen narrows. The lumen is the interior channel, the open space through which blood flows. It narrows. The blood still flows, just less and less of it. Patients don't notice at 20% blockage. They don't notice at 40. At 60, maybe some exertional chest tightness. They blame the stairs. They blame aging. At 70, maybe an abnormal stress test. By 80%, the ischemia is measurable. The heart muscle downstream is quietly starving. And we are finally having the conversation we should have had years earlier. The insidious thing about stenosis is that the system adapts. The heart compensates. Collateral vessels develop. The body routes around the blockage, finds alternate paths, and for a while, sometimes for years, the adaptation works. You'd never know the main channel was nearly closed if you weren't looking for it. I was 31 when I first opened a blocked coronary artery. Cleveland Clinic, 1992. The patient was 58. Inferior STEMI, right coronary artery, total occlusion. We were in the door-to-balloon time window. I threaded the guide catheter through the femoral sheath, crossed the wire past the lesion, inflated the balloon. The fluoroscopy screen showed the contrast dye filling the vessel downstream. TIMI 3 flow, complete restoration. The patient was awake, local anesthesia and sedation, and when the balloon went up, you could see something change in her, some tension releasing through the sedation, some color coming into her face under the drape. Afterward, the attending said, "You just gave her another 15 years, probably more." And I thought, that's the job. That's exactly what this is supposed to be. 38 years of it. New York Presbyterian first, Houston Methodist from 2001 onward. 12,000 procedures, angioplasties, stent placements, TAVRs in the later years when the transcatheter valve work expanded. I have operated on senators, on oil executives, on a former Secretary of State whose name I won't say. I have operated on school teachers from the Houston suburbs whose Medicare barely covered the facility fee. The anatomy was the same. The lesion is the lesion, regardless of who is attached to it. I was good at this. I want to say that clearly because the rest of this doesn't work if you think I was a mediocre physician who couldn't hack it. I was excellent. The American College of Cardiology Texas chapter elected me president twice. Medtronic paid me as a consultant for 15 years. I trained residents who are now running their own cath labs. The Houston Chronicle top doctors list, 17 consecutive years. Not because I paid for it, because my outcomes were exceptional. What I was less good at was other things. 3 marriages. The first lasted 9 years. Jennifer, from New York, a securities lawyer. Intelligent, patient, then less patient, then done. The second was 7 years. Claire, a cardiologist at Methodist. She understood the hours, which meant the hours were never the issue, which meant the issue was something else that we never quite named. The third was 4 years. Diane, 22 years younger than me, who I think wanted the version of a doctor husband that appears in films, present, attentive, the kind of man whose job has weight, but whose evenings are free. She was not wrong to want that. She was only wrong about who I was. Ryan, my son from the first marriage, he's 38 now. We haven't spoken in 11 years. I don't know his address. I know he's in Portland. I know he has a daughter because I found a photograph once. Not looking, just found it on the internet. His name comes up occasionally in local arts coverage. He does ceramics. The daughter's name, I don't know. She would be about 4 years old by now, maybe 5. The cardiac ball was the annual gala at Houston Methodist, black tie, the banquet room on the 4th floor of the Scurlock Tower. I attended for 19 years. I gave the keynote address in 2014, in 2016, in 2019. My name was on the program in larger font than most. I shook hands with donors, with hospital board members, with pharmaceutical executives whose companies were sponsoring the evening. I drank 2 glasses of the good scotch and then switched to sparkling water for the rest of the night, which no one noticed and which I did every year. At no point did I have a genuine conversation at this event. I had networking. I had the performance of warmth. I understood, even as I was doing it, the distinction. I performed warmth well. I was a physician. It was part of the technical repertoire. Patients needed to feel that you were present with them. Donors needed to feel that the hospital valued their contribution. You learn to produce the signal. I was being treated for stenosis in thousands of people while mine was progressing, the lumen narrowing year by year. Each cardiac ball, each conference keynote, each Medtronic advisory meeting where I recommended the device they were paying me to evaluate, just more plaque. The blood still flowed. I was still doing rounds, still scrubbing in. The system was adapting. Collateral vessels were forming. I had no symptoms. That's not why I left. I mean, the gala, the marriages, Ryan. I know how this sounds. The successful man who couldn't hold a relationship, who was cold to his son, who networked instead of connected. That's a certain story. I've read that story. It has a shape. It ends with the man in a trailer in the desert having learned something. I'm not sure that's what this is. Let me tell you about Harold Finch. Harold was 81 years old. Atrial fibrillation, chronic. Aortic stenosis, the valve this time, not the coronary artery. Severe by echocardiographic criteria. Ejection fraction, 28%. That's the fraction of blood the left ventricle pumps with each beat. Normal is 55 to 70. 28 means the heart is working at less than half capacity. And he had early dementia, mild, progressive. Harold had 3 adult children, all successful. A lawyer in Dallas, a physician in Chicago, a pediatrician, interestingly, and a finance executive in New York. They were engaged. They attended appointments. They had opinions. The Dallas lawyer had done research. He'd read about TAVR, transcatheter aortic valve replacement, the procedure we use to place a new valve through a catheter without open heart surgery. He'd found the outcomes data. He'd prepared questions. The family wanted TAVR. The TAVR would address the valve stenosis, possibly improve the ejection fraction, give Harold more time with better quality of life. They were not wrong that TAVR can do these things. In the right patient, TAVR is remarkable. I've done hundreds of them. I've restored years to people who had almost run out. The question is what the right patient looks like. 4 days before the scheduled procedure, I was reviewing Harold's chart in the cath lab office when a nurse told me he was asking for me, not the family, Harold. He was in a pre-op holding room waiting for some lab work. I went down. He was sitting up in the bed, oriented enough to know who I was, to use my name. Harlow, he said, not Dr. Harlow, just Harlow, like we were old acquaintances. His gaze was direct, clearer than I'd seen it in prior encounters when the family was present. He said, "I just want to go home, doctor. Not, I'm afraid of the procedure. Not, I don't want to try." Just that sentence, clear and complete. I just want to go home. I documented it. I wrote it in the chart verbatim. I flagged it. I requested a palliative care consultation, which was granted. I raised the question in the next family meeting that Harold had expressed a preference for comfort-focused care, that we should weigh this against the procedural approach. The family was distressed. The lawyer had data. The pediatrician in Chicago had spoken to a colleague. The finance executive had flown in from New York for the meeting. They loved their father. That was not in question. They were afraid of losing him. That was not in question either. The hospital administrator, not the CMO, not a physician, suggested during a sidebar that the family was well positioned to make this decision, that they were educated, engaged, that Harold's dementia made his expressed preferences legally complicated. The heart team review, which was supposed to involve pulmonology, cardiac surgery, and geriatrics, was abbreviated. One of the signatures was obtained by email. I know because I checked afterward. I performed the procedure on August 14, 2023. Technically, it was excellent. Access through the right femoral artery, valve delivery without complication. Post-deployment gradients were excellent. I watched the echo images confirm what they were supposed to confirm. The resident said, "Nice work." I said, "Thank you." We de-accessed. I wrote my note. I left the cath lab. Harold Finch died 6 days later in the ICU. Sepsis, aspiration pneumonia, multi-organ dysfunction. He was sedated when he died, a tube in his throat. confused in the moments when the sedation lightened. His family was in the waiting room, hospital policy at that point in the cycle, not at his bedside. I was in a different cath lab when the floor called. The resident told me later. I have thought about this every morning since, not every day, every morning specifically. The morning walk, 40 minutes in the scrub desert while the temperature is still bearable, and I think about Harold Finch, the Ocotillo, the saguaros, the roadrunners that appear sometimes on the flat sections of the trail. And Harold. I think the procedure was technically perfect. TIMI 3 flow, excellent gradients, everything nominal. I gave the machine what it asked for. I think, I just want to go home, doctor. I don't know if Harold Finch would have lived another year in comfort-focused care. I know the probability. It's not negligible. I know the literature on frail octogenarians with FEV below 30 who receive major valve interventions. I know what the data says about quality of life versus quantity. I have the numbers. I have always had the numbers. The numbers don't resolve it. That's the part I couldn't have told you before. February 2024, Sunday morning. I was preparing for an elective TAVR, different patient, similar profile, some of the same elements: age, frailty, family pressure. I was at the scrub sink, the water running over my hands, the betadine, the procedure I've done hundreds of times. I looked at my hands under the water. They were steady. They are always steady, that's the thing. Even at the worst of it, my hands were steady. 38 years of procedural steadiness is a discipline so deep it runs below whatever is happening emotionally. My hands would have been steady if they'd put me in that cath lab 12 hours after Harold died. I looked at them, steady as ever. And I understood, standing there, that the steadiness was part of the problem. The steadiness meant I could perform the procedure regardless of whether I should perform the procedure. The steadiness didn't know the difference. I had built something technically perfect that had no capacity for refusal. I turned off the water. I walked to the hallway. I told the second-year resident to scrub in, to take the case, that I was not available. I went to the parking structure. I drove to the Hobby Airport Marriott on Airport Boulevard. I don't know why the Marriott, habit of some kind, and I sat in the parking lot for 2 hours. Then I drove home and wrote my resignation by email that afternoon. I sold the house in the Houston Heights. I sold everything that required a truck to move. I kept the Cleveland Clinic mug, some clothes, the Cartier Panther I've worn for 22 years. It's in a drawer here. I look at it sometimes. I don't wear it. A crate of paperback fiction that I bought at a garage sale in Tucson 3 days after I arrived because I couldn't not have books. And the moleskin someone gave me years ago at some conference, which I've had the intention of writing in for 6 months and which has remained entirely blank. The Airstream was $4,200, 1978, 22 feet. The dealer in Tucson said it was original everything, which meant it was original everything that could go wrong. I paid the lot fee for a half acre, 11 miles south of Ajo. Water comes from a pipa truck every 3 weeks, 500 gallons, which lasts about that long if you're careful. The nearest neighbor is not visible. This is what I know now about the Sonoran Desert at 4:45 in the morning. The saguaros are not quiet. In the wind, they creak very slightly at the base, not loud enough to call a sound, but present if you're listening. The Ocotillo in bloom in summer is a specific orange, not red, and the hummingbirds appear at dawn and move through the blooms with a kind of systematic efficiency that I find almost familiar. The Gila woodpeckers nest in the saguaro trunks and make a sound that is nothing like what you'd expect from a woodpecker. The coyotes call at 3 in the morning, sometimes 2 of them in what appears to be a conversation. Between 2 and 4 in the morning, there is a silence here that I can't describe accurately. Not absence of sound. There are always insects, always something. but a quality of quiet that I have not encountered anywhere else. I know this because I'm awake for it. I've always woken at 4:45, but I wake before that sometimes, and I lie in the trailer and listen to the 2 to 4 silence. It is the only time since 2023 that I do not hear anything I did wrong. I don't have internet. I have a prepaid cell phone for emergencies. I haven't had a conversation longer than the truck drivers in 4 months. I do not miss conversation the way I thought I might. I miss precision, not the social performance, not the networking, but the moments in a cath lab when everything is exactly what it needs to be, and the information is clear and the action is correct. I miss those 8 seconds when the wire crosses the lesion and the contrast fills the vessel and TIMI 3 flow is confirmed. That specific feeling. I don't miss the rest of it. The treatment for severe stenosis is to open it up. Balloon, stent, bypass, you force it open, you restore the lumen, the blood flows again. We have excellent techniques for this. I've performed the procedure 12,000 times. Out here, I'm not sure what the equivalent is. I'm not sure there's a catheter for what closed in me, or whether it needs opening exactly. Some blockages in very frail patients, the body has routed around. The collaterals have formed. The adaptation has worked. The main channel is closed, and the system has found another way to deliver what it needs. I don't know which kind this is. I'm not running diagnostics on it. That's not why I left. Or it is, but not the way the story is supposed to go. I didn't leave because I was burned out. I didn't leave because the politics exhausted me, or the industry corrupted me, or the marriages failed, or Ryan stopped speaking to me. Those things are true, and they are also the surface. The surface stenosis, you could say. I left because I was standing at a scrub sink with completely steady hands, and I understood that the steadiness would carry me into that cath lab and out of it, and into the next one and out of it, and the hands would do what they were trained to do regardless of what I knew about Harold Finch. I left because I couldn't trust the hands anymore. Not because they were shaking, because they weren't. It's 6:20 now. The sun is clearing the ridge to the east and the light is coming across the desert flat, horizontal, the specific early light that makes the saguaros cast shadows 30 feet long. The mug is empty. The Cleveland Clinic mug, 1989, bent handle. No logo anymore. It wore off in some dishwasher some year, I don't remember when. I'll fill it again. I'll carry it to the folding chair at the edge of the pad, the one spot where the saguaro isn't blocking the eastern view. And I'll sit for another 20 minutes before the heat becomes the only fact. My hands are steadier than they've been in years. I've noticed this. The tremor I was tracking, very slight, only during the scrub, nothing anyone else would have registered. It's gone. My hands out here split open cardboard boxes and carry water jugs and fix the trailer awning bracket that rattles in the wind. They do the ordinary tasks of a life without equipment. They are steadier now than when they were doing the most technically precise work I've ever done. I don't know what that means. I've stopped running the analysis on it. The desert in the morning is the desert in the morning. The Ocotillo is orange. The coyotes are a mile east. Harold Finch said he wanted to go home. I don't know if this is going home. I'm not sure that question has a clean answer anymore.